Oh my gosh. Okay, you guys, we're going to do this again. So this is definitely a sacrifice. I'm trying. So let's see. All right. So I am a psychotherapist, but I am not on here to do anything related to therapy. Let me get my Instagram going, God. So I'm still new with a lot of this. So Instagram is saying it's checking my connection. Okay, looks like everything's fine. But as everybody knows, I'm still new and I'm learning. Do-do-do-do-do-do. We will be getting started soon. Um, so on Instagram, I'm able to change my image. So I'm going to be um, the lemon character. Let's see how this works. Yeah, the lemon character. I don't know if you guys can see on Instagram. So what we are going to be talking about is something that many people don't want to talk about, right? But I am a therapist. It's late at night. So we're just going to go there. We're going to feel comfortable. No judgment. I'm not going to do any therapy work. This would be a conversation. And we're going to talk about anxiety, depression, and stress. Someone said, Mom, who are you? I don't know who that. Anyways, okay. So if anyone have questions related to therapy, feel free to type them below. You can join my live if you want. Um, I am going over a PowerPoint that I created when I had my women's group. Oh, okay, that's my son. Okay, let me tell my son hi. Okay, so somebody said add me. I don't know if it's my son and his kids. Okay, so this is the PowerPoint I created when I had my women's group, which just ended. There were 6 sessions, and each week we talked about different topics. And so I am going to use this time periodically and go live and talk about some of these topics. Um, I was, I don't know, it's not working right. I was supposed to go live every Friday night, but that didn't work. Why is that let us join? Oh my gosh, let's see. So, yeah. So now I'm going to just present these different slides, and then one day I'll create a schedule or maybe every Friday. But right now, when I have time, I'm just going to go live and talk about different things. So my son just asked, can he? join my live. I don't know if you want to join tonight. Let's get ready to get started. I just sent him a thing so he could join us. So, invite, okay. All right, so let's talk. Anxiety. What is anxiety like? Gosh, anxiety is different for everybody. Some people have headaches, they worry a lot, they feel lonely, agitated, nervous, a lot of tension, a lot of frustration. Anxiety, anxiety, anxiety. Anxiety is also racing thoughts. Um, it's very challenging when you have anxiety, but anxiety can also be used in a positive way. I hope everyone can hear me on YouTube. I keep forgetting I have YouTube. I'm on YouTube and I'm on Instagram. Let me block somebody. Gosh, there's only three people out here. I gotta block somebody already. Let's see. Report comment. Hi. So I'm recording somebody blocked. Yeah. Hmm. Now, how do you delete it? That is so crazy. Okay. So, YouTube, what's going on is I had a couple people on my Instagram live and my son was on here and then someone he know, I don't know, just a lot of kitty stuff, but I got a little sidetracked. Let's go back to what we're doing. We're talking about anxiety. Anxiety, be brave. All right. Anxiety is a feeling of worry, nervousness, or fear about an event or situation. It is a normal reaction to stress. It helps you stay alert for a challenging situation at work, study harder for an exam, or remain focused on an important speech. In general, it helps you cope. So, there are positives to anxiety. Anxiety does not always have to be negative if you can manage it. Actually, anxiety can help you get a lot of work done. But anxiety can be disabling if it interferes with daily life, such as making you dread non threatening day to day activities like riding the bus or talking to a coworker. Anxiety can also be a sudden attack of terror when there's no threat. Yeah. So if you think something is going to happen, you start to get, you start to feel afraid. It's like fearful. So your heart starts to race, beats faster, um, and nothing has happened, but your anxiety makes you think that something has happened. So you begin to protect yourself. All right. Anybody have questions? Questions? Questions. All right, let's continue. So it's neat because on YouTube, let me see, YouTube, I'm not able to change my image. It don't look right. So on Instagram, it's so funny. I could change my image so many times. Okay. I kind of want to find one to stick to it. Let's see. I know on Instagram people be doing a lot. Let me see. Okay. So, YouTube, bear with me. because we know this is like real chill. This is not a hurry thing. If anybody have questions, just type your questions below and I will get to them. Type your question in the chat. It's not a problem. It's not a problem. Um, all right. So I don't know. I may have to go back to the first one where I was at. So that one was. Oh, I need to put the title at the bottom so everyone know what we're talking about. So we're talking about anxiety. ANXIETY. Anxiety, depression, and stress. That's why those kids was on here. I didn't. They thought it was something like fun for them. Let's talk. Okay. So, let's see. I pretend it. Awesome. 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 All right. Thank you, YouTube, for being so patient. I had to play around on Instagram real quick. So now we're on females and anxiety because, like I stated, this presentation was made for women when I was doing my women's group. I do have presentations that I'll be doing for men, but right now we're just going over the last PowerPoint. I just finished up. Okay, let's work together. Okay. Females are more sensitive to low levels of hormone that organizes the stress response. Women experience residual anxiety from sexual abuse, violence more often than men. Women are more likely than men to seek help for anxiety and get diagnosed. Why are females more prone to anxiety? Hmm, anybody know? Why? Why are women more likely to experience anxiety than men? It could be because of the difference in our brain chemistry. Yeah, maybe. Maybe it's hormones. Maybe it's our brain chemistry and hormones. Let's not argue. Okay. It could be because of differences in brain chemistry and hormone fluctuations. Reproductive events across a woman's life are associated with hormonal changes which have been linked to anxiety. This information was located at theconversation.com. You can look it up yourself. No need to debate. We're just having a conversation. If you have a question, feel free to type your question in below. If you would like to join, feel free to join me. Is anxiety more common in females? Hmm. Who knows? Let's see. Anxiety disorders also occur earlier in women than in men. Women are also more likely to have multiple psychiatric disorders during their lifetime than men. The most common to co occur with anxiety is depression. Yep. Can anybody relate? Whether you're a female or male, can any human being relate? Anxiety and depression. There are ways to naturally reduce your anxiety. So everyone handle anxiety different. There are some people that need therapy, medication. Maybe they could take care of anxiety by themselves. Maybe just natural remedies. It's up to the person. You can stay active by doing regular exercises, which is good for your physical health and emotional health. Don't drink alcohol or drink it in moderation. Alcohol is a natural sedative. Stop or decrease smoking. Ditch caffeine. Get some sleep. Meditate. Eat a healthy diet. Practice deep breathing. This information came from healthline.com. Just some tips. Just some tips. All right. So, how do you know you have anxiety? Do you diagnose yourself? Do you like talk to your teacher? Do you talk to the people at work? Who tells you? How is it confirmed? Well, one of the ways anxiety is confirmed is by testing. You will likely go to your medical doctor, let your medical doctor know what's going on, and your medical doctor will refer you to a psychiatrist. The psychiatrist will do random tests, and if you score high for anxiety, you'll be treated for anxiety and have a diagnosis of anxiety. And anxiety have other classifications that go along with it. But in this presentation, we're talking about GAD, generalized anxiety disorder. How long can GAD last? It could last for years or a lifetime. GAD is very common, more than 3 million United States cases per year. It is treatable by a medical professional, requires a medical diagnosis. Lab tests or imaging not required. GAD is characterized by persistent and excessive worry about a number of different things. People with GAD may anticipate a disaster and may be overly concerned about money, health, family, work, or other issues. So you guys hear the key word worry. Worry, worry, worry. Some things you worry about don't necessarily happen. Some things you worry about do happen. But either way, you have to deal with it, okay? So if it has not happened, you don't have nothing to deal with, so you don't want to put that extra stress on yourself. If you know for sure it's going to happen and it's proof, it's facts, then you could do something to handle the situation where it don't affect you as much. You can prepare to the best of your ability. Individuals with GAD find it difficult to control their worry. They may worry more than seems warranted about actual events or may expect the worst, even when there is no apparent reason for concern. GAD is diagnosed when a person finds it difficult to control worry on more days than not for at least 6 months and has three or more symptoms. This differentiates GAD from worry that may be specific to a set stressor or for a more limited period of time. To a set stressor or for a more limited period of time. So if you just having a day where you worry, oh, I'm worried about my car, okay, it's not that bad. But if you have days and you are in constant worry, then that's an issue. And it may affect you in many areas. You might notice changes in your sleep. You might notice changes in your appetite, your physical activities, isolation, um, your thoughts. Do anybody have questions? Um, no questions on YouTube? No questions on Instagram? I'm gonna take breaks throughout this. Okay, so the thing over here is, I want to get caught up. I was supposed to start doing this last year. So once I get caught up, I want to go to once a week. But how can I get to once a week if I can't even do once every couple of years? So yeah, I'm just trying to figure out how I'm gonna do this break because with, let's see. So it's fine on Instagram because nobody is on here. So if I go to, let's say, customization, disability, open, thumbnail, uh-uh, live chat, AI, I'm a limit. That is crazy. I'm a limit on Instagram. Okay, so I see the mute. Okay, I don't need the mute now. So people probably have apps, huh? That's how people be changing up their YouTube videos because they use apps. Participant proposal. All right, so we are on a short break. I'm about to type on Instagram on break. Oh my gosh. I don't know what to do. Okay, so all right, I'm back, y'all. I'm back. I'm back. I'm back. So we're talking about anxiety. What do anxiety look like? Okay. If you have anxiety symptoms, you might have constant worry, restlessness, and trouble with concentration. You may have racing thoughts. It might be challenging to get good sleep. Do you have severe ongoing anxiety that interferes with your daily activities? Hmm. Remember, talk to your doctor. You might have generalized anxiety disorder, which can occur at any age. The conditions for GAD are similar to a panic disorder, an obsessive compulsive disorder, as well as other types of anxiety. Is there help? Yes. Treatment may include counseling and medications such as antidepressants. Are there any coping strategies? Yes. Glad you asked. Try these when you're feeling anxious or stressed. Take the time out. Just chill. Count. Starting from 10 all the way to 0. If you're feeling really anxious, start at 100. Try that one. Eat well balanced meals. Try not to eat junk food all day. Try to eat something healthy. Have a little balance. Limit alcohol and caffeine. Yes. It's going to trigger you in different areas. Get enough sleep. Sleep is important. Like what I need to do. But I have a goal. Okay. Exercise daily. Yes, staying active matters. Staying active matters. Take deep breaths, count to 10 slowly, do your best. Accept that you cannot control everything. Okay? Welcome humor. Life is sad, yes. Welcome humor. It's not going to be your last issue. It's not going to be your last decision that you make, you regret, or feel bad about. So, try to find humor. You can't please everyone. There's this thing called rejection. Yeah. And you have to just deal with it. Get involved in something. Um, find a network. All these social media platforms, you can find Facebook groups, Instagram groups, YouTube groups. Think about your interests and find people that are doing the same thing. Talk to someone. Yeah, find somebody to talk to who you could trust. It's not easy, but is it necessary? Yes. I'm looking for my limit on what's it called on Instagram? Let's see. All right, there go my lemon. All right. So because these slides are so long, and I'm talking about three different things, I'm going to skip through. My goal was not to skip through these, and I don't want to, but I really don't want to go through all of these slides. So, what is anxiety? Just simply put, anxiety is a mental and physical reaction to perceived threats. So if you think something is going to happen or you're worried about something happening, and you're going to react. Your body will start doing things. You may start panicking. You may start sweating. Your heart may start beating faster. You may start having racing thoughts, negative thoughts. In small doses, anxiety is helpful. Yes, anxiety can help you get a lot done. Um, but it's also if you have a positive self esteem. So if you have anxiety and positive self esteem, you can push yourself to get a lot done in a week because you want to avoid procrastination, doing things at the last minute. So you tell yourself, I want to get this done by Friday. It's Monday. I want to get it done. Anxiety will keep bothering you. Like, I want to get it done, I want to get it done. But it's not negative because you're taking a big job and breaking it down to small parts. Sometimes when people are nervous about things, they will have anxiety and they will freeze. They'll stop doing everything. Um, so anxiety could be used positive. Um, so anxiety, it protects us from danger and focuses our attention on problems. But when anxiety is too severe or occurs too frequently, it could be debilitating. So, if we're somewhere where we're new or unfamiliar territory, you're going to feel anxious. Your anxiety would definitely be heightened because you don't know. So you may have some type of fear or worry about the unknown. Symptoms of anxiety. So we went through this already, but let me go through this whole list real quick. Uncontrollable worry, excessive nervousness, sleep problems, muscle tension, poor concentration, increased heart rate, upset stomach, avoidance of fear. So, have you ever been called to give a speech? Most people hesitate at first because of, it's like, I don't want to talk in front of all of those people. They're going to look at me. They're judging me. What do I wear? What do I say? How do I look? How do I stand? How do I perform? Thoughts, anxiety. But self talk matters what you say to yourself. So there are techniques to help you. All right. So this next slide, I already talked about GAD. So phobias. Now that's a little different. So you have your regular anxiety. Now let's talk about phobias. What's the difference? Phobias, that's a very intense fear of a specific situation or object, which is out of proportion to its actual threat. For example, a fear of giving speeches or of spiders could be considered a phobia. Yeah, like how I just said. Um, so as you see, given given a speech has its different areas where it could be affected. So, like if you're giving a speech, you could be anxious. You could also have a phobia. You could also go into a panic attack, right? So it all depends. Um, I think I meant to say branches. Anxiety has several branches. I don't know. Wait, giving a speech has several branches. You guys, it is 2 in the morning. But I'm dedicated. I'm gonna do this. I'm gonna do this. All right. So panic. Let's talk about panic. An extreme anxious response where a person experiences a panic attack. During a panic attack, the individual experiences numerous physical symptoms and is overwhelmed by a feeling or dread. So the panic attack is more extreme. So it's like anxiety times 1,000, where you could just about be crippled when you have the panic attack. Like your chest may tighten, you may lose speech, you may shake. Um, yeah, panic attack can may cause you to go to the hospital. You may lose your breath. You can't breathe. So panic attack is real. So that's why when you have anxiety and you notice your anxiety getting out of control, you want to get some help. How does anxiety grow? Anxiety drives people to avoid the things that scare them. When a scary thing is avoided, there's an immediate but short lived sense of relief. However, the next time a similar threat arises, it feels even scarier. This creates a harmful cycle of avoidance and worsening anxiety. So you have anxiety, and then you avoid a scary thing. Then you have temporary relief from anxiety. Then you have anxiety. Then you avoid a scary thing. Then you have temporary relief from anxiety. So you definitely want to pay attention to your body. There is something called deep breathing. So this is a coping skill. When you have something going on with your body, yourself, you want to find out what are ways to cope, because likely these things are interfering and allowing the negative thoughts to take over, and you're not being able to get your goals met. So deep breathing is a simple technique that's excellent for managing emotions. Not only is deep breathing effective, it's also discreet and easy to use at any time or place. So, how do you do it? All right, let's see. I do not want to turn my camera on. We still on anxiety. I don't know if I'm going to do anything. Let me see. YouTube, I'm going to hit for 40 minutes. Okay, let me see. Hmm. Okay. Mm, jeez. All right, Lemonhead. How do you get badges too? So on Instagram, y'all, what is that? Video? Oh, that is. Oh my gosh, this is what I wanted to do. Dang, sorry, y'all. I see I can mute it too. Sorry. I have a cold and I haven't taken my medicine because it might make me feel tired, and I didn't want to do that if I was going to be doing this video. So, bear with me. This is laid back. If anybody joining, feel free to leave a question or comment. Um, it's just a conversation, a discussion. Okay, it's not any real clinical advice. You would talk to your specialist for your mental health concerns. Okay, so it's not anything like, if you hear anything that's helpful, good, take notes. But always talk to your mental health professional if you have questions regarding your mental health. So let's practice deep breathing. So you'll sit comfortably and place one hand over your stomach. Breathe in through your nose, deeply enough that the hand on your stomach rises. Now hold the air in your lungs And then exhale slowly through your mouth with your lips puckered as if you're blowing through a straw. The secret is to go slow. So you'll time the inhalations for 4 seconds and pause. 4 seconds, you'll exhale for 6 seconds. Practice for 3 to 5 minutes. This will help decrease anxiety. It may seem like it's nothing, like, oh, it's nothing. I could breathe, it's not enough. Try breathing. No, it's more internal because when you have anxiety, you're revved up. And anxiety could get to the point where now you're having a panic attack. So if you do the reverse, right, by controlling how you breathe, that will be more beneficial for you. It'll help you to calm down. So just try it. Like I said, this PowerPoint is long. I want to get through this. We're still in anxiety, and this is not cool. I thought I would be better right now. Oh my, oh my. All right, so there's something called progressive muscle relaxation. So if deep breathing is a challenge, there's other exercises. So I'm not going to go through these because I want to get to the next one. So we already talked about things you can do when you're feeling stressed or anxious. I'll go back through the list really quick, really fast, and in a hurry. So just take a time out, practice some yoga, listen to music, meditate, get a massage, learn relaxation techniques. Eat well balanced meals. Try not to skip meals. Try to eat a healthy, energy boosting meal or snack. Limit alcohol and caffeine, which can aggravate anxiety and trigger panic attacks. Get enough sleep. When stressed, your body needs additional sleep and rest. Exercise daily or stay active. Do your best. Instead of aiming for perfection, which isn't possible, be proud of however close you get. Be proud of yourself. Tell yourself, I did it. I'm trying. I will keep trying. Count to 10 slowly. You can start at 0, start at 1, go up to 10, start at 10, go to 1 to 0, start at 100, go all the way down to 0. It's the same thing, reverse. Reverse. So it's almost like a person who is angry a lot. It might be helpful for them to have a pause before they react. Because once you react, you can't take that back. So if you could pause, like go for a walk, do some counting, deep breathing, do something else real quick, that will help so that you don't make uh, decisions that you regret later. All right, back to it. Accept that you cannot control everything. Yes, put your stress in perspective. Is it really as bad as you think? Is this really going to turn out negative? You don't know. You don't know. It hasn't happened. Welcome humor. A good laugh goes a long way. There's so much to be stressed about. However, sometimes just finding humor is helpful. It's not easy. It's just necessary sometimes. Maintain a positive attitude. Yes, make an effort to replace negative thoughts with positive thoughts. So if you find yourself saying things like, I can't do it, nobody likes me, I'm all alone, I wish I worked somewhere else, try to tell yourself positive things. There are people that like me. I like myself. I love myself. I'm where I want to be. I will move or travel or visit someplace else when I get ready, when I want to. I will set goals to make these things happen. I can control my thoughts, my behaviors, and my actions. I could think positively. Okay? It's not easy, it's necessary. Get involved. Sometimes getting busy matters. Sometimes when you're hurt and you help someone else, it helps you to feel better. So volunteer or find another way to be involved and active in your community. It creates a supportive network and gives you a break from everyday stress. But you want to be careful because if you're a people pleaser, you don't want to put too much on your plate and now you're regretting helping out because everything is on you. So be careful. You have to know how to say no. Learn what triggers your anxiety. Know thyself. So you see, that some people just know how to push your buttons and they think it's funny. Is it work, family, school, or something else you can identify? Write in a journal when you're feeling stressed or anxious or look for a pattern. You can write in a journal and tear up the paper afterwards. You can write in the journal and keep it to look back on. You can, if you're good with poetry, turn your pain into power. Write about it. Write a story as if you're not the character. Put it in somebody else's life. Create a song about your life. If you're into beats, create beats. It's a lot of ways to be creative with your anxiety. Um, and know your triggers. Is it a person that come around and makes you feel anxious? Is it situations like social anxiety, like when you're out in public? Um, are you triggered by behaviors? Right. So you want to know yourself and find out what makes me anxious. Talk to someone. Tell friends and family when you're feeling overwhelmed, and let them know how they can help you. Talk to a physician or a therapist for professional help. Yeah, definitely. A doctor can help guide you, and like I stated, can also give you a test if that's what you want. A therapist could listen, help you with goals, and kind of hold your hand through the process. You're not alone once you have a therapist. It's activity time! Woohoo! But I have no participants at this time. So, just like the last session, I am going to skip this part. Okay? So, we're going to get to depression. Oh my gosh. I'm talking about this stuff at almost 3 in the morning. Okay, let's keep it moving. We gotta stay motivated. Because as long as I'm recording this, then hey, we can come back to it and watch it. Depression. What is the true meaning of depression? Depression, major depressive disorder, is a common and serious medical illness that negatively affects how you feel, the way you think, and how you act. Fortunately, it is treatable. Depression causes feelings of sadness and or of loss of interest in activities you once enjoyed. If you suffer from 5 or more of the following symptoms of depression, and these symptoms are present for 2 weeks or longer without physical cause, you should contact your psychiatrist or your medical physician. And remember, this is not a diagnosis. You will have to talk to your doctor. We're just having a conversation. Depression checklist. Persistent, sad, or empty mood. Loss of interest or pleasure in ordinary activities, including sex. Decreased energy, fatigue, being slowed down. Sleep disturbances, insomnia, early morning waking or oversleeping. Eating disturbances, loss of appetite and weight or weight gain. Difficulty concentrating, remembering, and making decisions. Feelings of guilt, worthlessness, helplessness, thoughts of death or suicide, suicide attempts, irritability, excessive crying, chronic aches and pains that don't respond to treatment. I found this information from Fairmount VHS. So, you don't treat yourself, you talk to a medical physician if anything I just listed is alarming to you. So, I had another activity scheduled, but let's see. Nobody. All right. All right. What are what are some main causes of depression? Abuse. Okay. Physical, sexual, or emotional abuse can make you more vulnerable to depression later in life. Age. People who are elderly are at a higher risk of depression. Certain medications. Conflict. Death or a loss. Gender. Genes. Major events. A lot can lead to depression. Some people have multiple things, not just one, but multiple things that lead them to depression. This information was found on WebMD.com. So the next slide, I have all the things that I had listed more explained, but because of time, we're gonna kind of like just pass all that. All right. In the workplace, depression may be recognized as decreased productivity, morale problems, lack of cooperation, safety problems and accidents, being absent a lot, frequent complaining of being tired all the time, complaints of unexplained aches and pains, alcohol and drug abuse. Depression tips. I'm going to skip through these and see if I have a shorter list. Maybe I'll come back to this another day. But I could clearly see because when I did these presentations, it was with a group for 1 hour, and the max was 1 hour and 30 minutes. But on YouTube, I'm already close to 1 hour, and I'm on my second subject. So I still have not talked about stress. So um, I'm not understanding. I need management. Okay. Do anybody have questions? Questions. If you have questions, please type your questions in the box below. If you want to join, no problem. Feel free. You can join me. Okay, what are some unhealthy coping skills? Well, remember, we're talking about depression. So, negative coping skills would include criticizing yourself, negative self talk, driving fast in a car just for no reason, like driving 100 miles per hour in the 25-mile per hour lane where there's traffic on and off. Chewing your fingernails could be a sign of anxiety, and according to this article, depression. That's the way how people cope when they're depressed. They may bite their fingernails. Um, Becoming aggressive or violent, hitting someone, throwing or kicking someone. That's how they're responding when they're angry, when they're depressed. Eating too much or too little or drinking a lot of coffee, smoking or chewing tobacco, drinking alcohol. Um, these are all of the ways people so-called help themselves. Activity time. Taking control. So this came from kidshealth.org. How do you take control when you're depressed? Well, you recognize you're not alone. Although not everyone experiences mood changes in the same degree, they are common. Okay. Catch your breath or count to 10. Talk to people you trust. Friends can help each other by realizing that they're not alone in their feelings. Exercise. Get enough sleep. Create. Cry. Wait. All right, let's get through depression. I feel like I covered it a lot. These next slides are just activities and more tips on depression. Ooh, yes. So now we're at stress. Ooh, we're wrapping this up. Yay! I'm almost at an hour on YouTube. Good. Oh my gosh, this is so. All right, let's talk about stress. Okay. What are some causes of stress? Many causes of stress. But when you have stress, how do you know? Do someone tell you that you're stressed? Do you just think you're stressed? Do your body react differently? Well, all of the above, maybe. But for sure, your body may react differently. How so? Well, if your stress is not managed well, you can have high blood pressure, depression, diabetes. You can have sex problems, skin diseases, allergies, overeating, kidney diseases, breathing problems, increased smoking, a lot. Stress is a feeling of being tense, overwhelmed, worn out, or exhausted. A small amount of stress can be motivating, but too much stress makes even small tasks seem daunting. Sometimes stress is the accumulation of many small hassles, while other times it is the result of major life changes or long term problems. Activity. Okay, let's go through this. All right. So, what are some physical symptoms of stress? How do you know? So, if someone tells you they're stressed, this is probably what they're experiencing. Low energy, headaches, upset stomach, including diarrhea, constipation, and nausea. Aches and pains, tense muscles, chest pain, rapid heartbeat, insomnia, frequent colds and infections, loss of sexual desires and or ability. The emotional symptoms of depression may include just a general unhappiness, anxiety, agitation, moodiness, irritability, anger, feeling overwhelmed, loneliness, isolation, and other mental and emotional health problems. This information was found on webmd.com. Ways you can reduce stress: exercise, eat and sleep well, meditate, solve the cause of your stress, avoid stressful situations, avoid things that you cannot change, don't take on more than you can handle, try a glass half full attitude. Still saying your glass is half empty, so your glass is half full. Ways you can reduce your stress. Breathe. Just like with anxiety and depression, you can breathe. Slow breaths can help lower blood pressure and heart rate. It's almost 3 o'clock, you guys. I'm making it. Listen to music. Take a quick walk. Find the sun. Give yourself a hand massage. Count backwards. Stretch. Rub your feet over a golf ball. These were found on colorado.edu.law. All right. Ways to reduce your stress is next. I've talked about that. Okay, good coping skills. We talked about this. Let's just go with some positives before we end it. We're wrapping it up. Yay. Practicing meditation and relaxation techniques. Having time to yourself. engaging in physical activity or exercise, reading, spending time with friends, finding humor, spending time on your hobbies, engaging in spirituality. So, how do you get a better night's sleep? Make it a priority by setting an alarm. Get into a routine. Unplug social media or video games. Avoid caffeine. Optimize your environment. Get your environment right. Do not use your sleep area for also your video game, your fun area. You want to have aim for a dark, quiet, and peaceful place when it's time to go to sleep. So your brain can know, like, okay, we're in this area. Time to be quiet. Okay, let's see. Oh my gosh, I made it. Yeah. All right. Well, thank you so much. That was nice. We made it. I will get better, but right now I'm just happy to finally go live. I was supposed to do this last March 2020, and I never got to it. So now I'm halfway doing it, but I'll get better soon in time to challenge this whole commitment thing and just, it's a lot. But I'm going to go through my 6 weeks of PowerPoint that I just did with my women's group. And yeah, we're going to make it and get better in time. So thank you so much. I hope this information was helpful. And everyone have a wonderful night. I'm signing out of YouTube. So then